So there were a couple of papers recently came out suggesting the increasing incidence of colorectal cancer among the young. Also, as a physician, my colleagues and myself have encountered a handful of patients who were diagnosed with colorectal cancer at younger age. It was a little surprising to us, but at the same time, we become very interested in this topic to see what's driving force for this increasing colorectal cancer risk among the young. That's why we came with this study. So the causes of increasing colorectal cancer incidence and prevalence among the young are not very clear. There has been suggestions that obesity, dietary and environmental factors, and also very low effective screening method and even the poor access to health care may play certain roles. But all these are still under speculation. That's why we would like to take the first step to better characterize the differences of colorectal cancer between the young and old, and which can provide further information for future study. And we hope that lead to a step forward, and we will to see better to come. So the minority, we all know, they have increased risk of colorectal cancer among the old. Why also same trend happens among the younger population? The exact mechanism are still poorly understood, but we speculate that the similar risk factors such as obesity, diet, and especially the poor access to high-quality health care may be possible reasons. So in the future study, we will look into more detail about these risk factors, how they play the role in both general younger onset colorectal cancer and also in minority. What we currently know about this disease are still just the tip of the iceberg. We do know that the young onset colorectal cancer seems to be more aggressive pathogenically, and also this happens more frequently in the minority. And we also understand that some genetic factors such as FAP, familial adenomatous polyposis, and Lynch syndrome, they account for just only 10 to 15% of this disease. The remaining so-called sporadic colorectal cancer, they have hidden the risk factors behind the young onset colorectal cancer are so poorly understood. We hope in the future, by doing more in-depth research, we can understand the risk factor and also pathogenesis in better details. So based on our limited knowledge from our study and also other people's study, we'd like to suggest a few things on the CRC prevention, general and also specifically for the younger population. Number one, we think all the family doctors and GI doctors as well as patients should all be aware of the increasing incidence and more aggressive features of colorectal cancer among the young. Second, it seems to us that screening for age 40 to 50, especially for the minority, may be beneficial. Third, definitely the better understanding of biology behind this disease are very important and warranted to develop a risk factor stratification as well as prevention strategies that should be feasible and affordable. We hope that's near future. We think this research we're going to carry on continuously. My colleagues and I are working together on characterizing the genetic profile of colorectal cancer among the young using human colorectal cancer tumors, tissues, which we have banked locally, and also we can obtain from international consortiums.